Hello, everybody, and welcome back to another episode with me. So, today we're going to be talking about hearing loss, also known as deafness. Okay, now the question is, what is being deaf? So, being deaf is just the inability to hear. Now, how does it present itself? It presents itself in normally two different ways. It's either you are totally deaf or you are hard of hearing, meaning you can hear only when somebody shouts or when they speak louder. Now, the question is, how does the state of being deaf come about? Now, it's either a person can be born deaf or they can actually acquire it later on in life. I'm not going to attach years as to when a person can become deaf because it can actually happen anytime. Of course, there's always the peak season, the peak time, and the less frequent years or ages. However, I'll just group them into two. It's either you are born deaf or you acquire it afterwards. Now, many times in instances where a baby is born deaf, very little could be done to reverse that. Okay, but there are times that when maybe a baby is born just fine, is able to hear, and then along the way they start losing their ability to hear so effectively. Eventually they totally just lose the hearing. Okay, so now this also depends on different factors. Sometimes trauma can lead to hearing loss, like a huge slap to your head. Sometimes being exposed to extreme velocities of noise, all that can destroy the eardrum and all that. Sometimes even illness. Yes, so illnesses, some certain illnesses could injure the brain, the ears, or could also injure the nerves that make us be able to hear. Now, I'm going to talk about deafness at a different level. I, for one, I've got friends. I've got friends who were born deaf. I have other friends who were born hearing and then lost their hearing later on in life. And most of these lost their hearing when they were still, below the age of 15. And in most instances, what caused that was illnesses. I remember the time I was young, we had some drugs back then. I think some of you would relate. There was chloroquine, which could taste as sweet as aloe vera, or chloroquine was very, very bitter. I always dreaded taking chloroquine. But again, there was another drug, quinine. About quinine, quinine had a certain after effect, where you take it and you'd feel a certain very, very irritating, sharp sound in your ear. It would last for quite some time. But anyway, back in the days, there were times that um, being exposed to certain drugs at a tender age, or maybe being overly exposed, or even an overdose of those drugs, would put you at risk of losing your hearing. So that is about hearing loss. Now, what do we do about our friends who have a problem with hearing? Most of my friends who know me by now know that I strongly advocate for them to know at least the basics in sign language. You don't have to know translator level, just the basics where you'll be able to communicate with the next person. Hello, how are you? Oh, I want some water. I'm thirsty. I'm tired. Where do you stay? Just very, very common, basic words. Why I say so is because look at this. Right now, I'm based in Chipata, and the common language here in Chipata, the common tribe here in Chipata is Nyanja Chewa. Not to say that I don't understand Bemba. I'm not very fluent. My friends know that I'm not Bemba, I'm not very good at Bemba, but I'm able to understand some words. I can construct, but it's kind of hard. I still try. But at least I'm able to speak in Bemba. I can understand. I'm able to communicate in English, Bemba, Nyanja. I can hear some Tonga. I can hear some Lenje. I can hear some this and that and that. See, I'm able to understand. So even when I go to a different place and I find that they are speaking, even though I don't get the whole conversation, I'll still be able to understand, oh, these are talking about something like that. So this is why I always advocate for people to learn just the basics in sign language, because today it might not be you who has the who is deaf. It might be the next person. Who knows? It could even be your own child. But then what do you do? Here is your child who unfortunately is deaf. How then are you going to communicate to that child if you do not want to associate yourself, if you do not want to learn? I have come across people who say, we'll cross the bridge when we reach there. Yes, quite right, you can cross the bridge when you reach there, but sometimes preparation is always important. Not that we're preparing ourselves to get deaf, but what about if your close friend or your relative or just somebody foreign needs to talk to you, they need to get some information from you, how are you going to be able to communicate? And mind you, it's not everybody. It's not, I've seen people who would resort to just writing. It's not every person who is deaf who is able to understand, right? But they could be able to read some signs. Not to say that sign language is broad, okay? Just like we have languages, hear me right? Just as we have languages, we have English and we have Bemba Nyanja. In my space right now, I could say this is a phone, right? Hello, hello. But then others could say this is a phone. So now, if we have communication breakdowns, very, very hard to understand each other. Yeah. So even in sign language, it's not just one sign language everywhere. No, no, no. Those people who are based in a certain region have got a way that they communicate. Other people in other regions also have a way that they communicate. But most important is just knowing the basic, the common sign language, right? And that is the Zambian sign language, at least. There are other different sign languages, but at least have the one that we use locally so that you're able to communicate with the next person. Okay, so another thing I would like to tackle on is persons who have hard of hearing. Now, what is hard of hearing? Hearing, as I mentioned earlier, is a state where I'm able to hear only when you speak a little bit louder. And these are the people that you're going to find having those hearing aids. Some do not have, others do have. And how do we help these people? Most of them require that as you are speaking to them, they look at your lips and read. Okay, it becomes easier for them to understand what you're saying if they are looking at your lips. So it's very, very rude. I have, on several occasions, I have interacted with my colleagues who are deaf, and through my experience with them, I have come to learn that it is actually very, very rude. One, to sign gibberish. What do I mean? When you see somebody who is deaf, you know they are deaf, and you've been seeing on television the translators, and you'll be there, okay, that one is deaf. That is very rude. That is very, very rude, and that should never. Mm-mm, mm-mm. You just don't do that. It's like you're making fun of them not being able to hear, and that is just not good, even at a human level, guys. No, that's just not good. Another thing is when you know that this other person needs to look at you, maybe as you are communicating, maybe they are hard of hearing, give them your face. Don't talk looking somewhere else, because in sign language it's not just the hands that communicate. Okay, the whole body, your eyes speak, your face speak, facial expressions matter. They really, really matter, because I can't say I'm happy and you're like this. No, you have to show I'm happy. It shows. Okay, so with sign language, facial expression, number one, very, very important. Eye contact, number two, very, very important. Number three, gestures. You don't just sign all over the space. You have to maintain a certain area. And that is why I would always advise you to learn just a few basic sign language skills. So thank you so much for your time. I'm sure we're going to pick it up later on, but for now, I'm going to say bye and thanks so much for watching. See you next time.